Imagine a time when surgery, a life-saving procedure today, was an agonizing ordeal of unimaginable pain. Before modern anesthesia, patients faced the ultimate test of endurance. Centuries ago, the lack of effective pain relief turned every amputation into a brutal spectacle. The screams of patients echoed through makeshift operating theaters. Often, infection ravaged limbs, leaving no choice but amputation. This desperate measure was the only way to prevent the spread of gangrene and save a life. To dull the senses, patients were often given copious amounts of alcohol. A temporary stupor was their only defense against the impending agony of the surgeon's knife. Herbal mixtures, some with sedative properties, were also administered. Opium and mandrake were common, offering meager comfort against the brutal reality of surgery. Perhaps the most iconic image of pre-anesthetic surgery is the patient biting down on a piece of wood. It was a desperate attempt to channel pain and protect the tongue. The surgeon, often covered in blood and sweat, worked with terrifying speed. Every second counted in minimizing the patient's dreadful ordeal. The moment of the first incision was met with screams of raw, guttural pain. The absence of anesthesia meant every cut, every saw stroke, was felt acutely. Crude, unsterilized knives and bone saws were the primary tools. Their appearance alone speaks volumes about the brutality of historical surgical practices. Speed was paramount. A skilled surgeon could complete an amputation in minutes. Minimizing the patient's conscious suffering was the highest priority. Assistants played a crucial, grim role, holding patients down with sheer force. Their task was to ensure no sudden movement compromised the delicate, brutal procedure. Even if the amputation was successful, shock and blood loss were immense. Many patients succumbed in the hours following their ordeal, making survival a true testament. Without antibiotics or sterile techniques, infection remained the greatest post-operative threat. The operating room itself was a breeding ground for deadly bacteria. Historical medical manuscripts vividly detail these harrowing procedures. They offer a window into the difficult decisions and limited options surgeons faced. Surviving surgical tools from this era are chilling artifacts. Their crude design testifies to the brute force once necessary for medical interventions. These historical accounts remind us of the immense suffering endured by patients. Their bravery in the face of agonizing procedures paved the way for future medical advancements. The discovery of anesthesia in the mid-19th century revolutionized surgery, finally sparing patients from conscious agony. It marked a turning point in human compassion and medical science. Today, we often take painless surgery for granted. Remembering this brutal past helps us appreciate the miracles of modern medicine and the continuous pursuit of human welfare.